for things that are missed is significant. And then the second part of rationale is that the professionals that are responsible for doing this need to be exposing themselves to risk, and hence should be incentivized to do this in a vigilant way. So there's a patient need, and then there's a provider need as well.
And the provider need is not just a monetary need. The provider need could actually be a legal need, because if they're not screening, exactly, and if the hygienist isn't documenting or the doctor isn't documenting correctly, they're going to be in court.
Correct. Right. That was really the risk I was speaking of, is that if they're going to, they need to be incentivized correctly, and that incentivization is a reduction in their risk, their exposure.
Okay. I didn't get that written very, would you want to type that to me when we're done, Dr. Nemechek, in an email?
Okay. Yeah, whenever there's a change in coding or not just coding, but when there's a change in how things are done, I think it's always very prudent to be patient-centric. So the first rationale is a patient-related rationale, and then the second rationale is a caretaker rationale, and both are equally strong and related, obviously.
Yeah.
So I can type something about that.
Okay.
And that makes sense, because you want to be able to come across in both directions like that.
Right.
Correct.
Right.
Correct. Mm-hmm.
Okay. Excellent. So we've got our rationale. So as far as we do have research are supporting, we do have some research in different things to submit. Let me find it here. Supporting documentation, literature, that type of thing. And here are some of the things that we have as far as statistics, and that type of thing for submitting evidence. Dr. Nemeth, anything else that you would recommend or see that we could add to this?
So I'm on the phone, so I don't see a screen that you guys are seeing.
Okay, so we have some statistics.
I'm seeing the Word documents in the email, but I'm not seeing this real screen.
Okay, so under on that Word doc, under the like where we were on number 8, it says case studies and stats.
Yes.
Some things like that to submit to them.
Okay. Okay. Case study and stats. All right. 1%. Okay. Yes. Okay. Yeah. So the rapid rise in HPV-related head and neck cancers over the last 20 years. Most of head and neck cancer, including oral cancers, found in later stages, 3 and 4, and it is very function changing in all of its forms, right?
Mm-hmm.
Okay, there they are. Okay. Okay. Have a code for adjunctive devices. What does that mean?
That's the Velscope and the oral ID.
Okay.
They, fluorescence, the tissue fluorescence, and the ADA does not recognize those as any standard of care, yet we have a separate code for those devices to be used. But in their latest stance that they came out with in 2017, they didn't recommend the use of those for screening and evaluation.
Correct. So in full disclosure, so I was on that committee that helped the ADA do that. And so don't get mad at me. And so but you're right, it is a disconnect that these things are available, that the ADA that we really ask the ADA to not approve that, but they're still coded and reimbursed.
Right,
which is a huge disconnect, of course.
Yeah, and no, we're not mad at you at all. It's just that, it is a huge disconnect, because here we have what's considered to be the gold standard, which is it's the hands-on extra oral, is that visual tactile, and they're saying that to do that where indicated.
That's right. That's right. So I think you need to script that in a way that, without saying that that's ridiculous, that it's kind of ridiculous. So there's something that's not ADA approved, but it's getting billed and paid, and the gold standard is neither. So yeah, I think there's a way to say that and to illustrate that very significant irony.
Right. Is there anything? Do you think American Head and Neck Society would be willing to be a co-submitter with us on this?
On the coding front?
Yeah, because we can have, organizations, people like yourself, any professionals or organizations be co-presenters. They don't always necessarily have to be there, but they could be a co-submitter with us if they
co-supporter. Yeah. So we're part of the, as you know, we're part of the prevention committee, the outreach and prevention committee. So let me do a quick out. That's a very specific thing to ask, and what leadership thinks about the legal part of that and the precedent part of that. And we do want to bring everybody in the fold for prevention and screening and such as that. So let me ask our gang.
Okay.
So H&S as a co-supporter, co-presenter for this process. Okay. Let me ask.
Okay.
Before I volunteer, a huge organization.
Yeah.
But our small group, the prevention outreach and prevention group, is pretty robust. So and that was our group that helped the ADA do it the first time. So let me work on that a little bit.
Okay.
Because that might provide added, credence to that.
Yes, absolutely. Absolutely. And so our timeline is Patty DeGangi, who's really in charge of all of this ultimately. She wants to have this form completed by September 29th. However, it's not due.
That's like a week, right?
It's 2 weeks. 2 weeks from yesterday. Okay. But it's not due to the CNC until November 1st. But he just wants to make sure that we have this, solidified. So I was just kind of giving you some timeline there as far as what we're looking at.
Okay. So that's going to have to be, I'll reach out to the guys and that's going to have to be a quick up the chain sort of thing. The subcommittees have a lot of autonomy, which is really nice. And so our group can probably decide that, amongst ourselves, and it doesn't sound like a big ask, frankly. Any barrier to screening and prevention, even if it's a coding and financial barrier, that seems like an easy thing to do.
Okay. Well, thank you for.
We certainly went out on a limb to advise the ADA to not use these adjunctive maneuvers. We went out on a limb on that respect. We can certainly go out on a limb on this, I would think.
Yeah. So while we have you here, do you mind expanding on that as far as your reasoning behind the adjuncts?
the group's reasoning was that these tests were highly sensitive and with almost no specificity, and so they weren't superior to somebody looking with the naked eye and palpating. And so if you combined that, in other words, you had to see many patients and biopsy a lot of people to find very few people with an at-risk lesion.
Mm-hmm.
So if you combine that with the cost, i.e. billing, then you had to bill a lot of people to find a single person with cancer. So that was the thought.
Okay, thank you. I appreciate that.
And so it's not dissimilar to if you're going to screen with mammography or PSA or colonoscopy, it better have some specificity to it as well.
Right. Okay, thank you. I appreciate that. So can you think of anything else any research or anything else that we would need that would be good to add to these statistics and submissions in that respect?
I was thinking along the HPV vaccination front and about other maneuvers, other cancer prevention maneuvers across a large population that have been, in other words, some precedent that have been accepted for billing and coding. And so that maybe to include a line about vaccination, that, for example, that risk screening and vaccination has been approved for, coding consideration and billing consideration, and this might be in the same vein.
Okay.
As because you have a lot of background lines there. Mm-hmm. About things about head and neck cancer, and I think the scope of the problem and also barriers to screening and prevention should be in there as well. One of which is HPV risk stratification and vaccination.
Okay.
In other words, other organizations like CMS have agreed that screening and community-based prevention maneuvers are codable and reimbursable.
Okay. Remind me, who's CNS?
So CMS is who pays us. So Medicare, Medicaid.
Oh, okay.
And the private carriers follow CMS.
Oh, CMS. Okay.
Sorry, CMS, yeah.
Okay. Yeah. Okay.
So third-party payers usually follow what CMS deems is appropriate.
Right. Okay. Great. Denise and Michelle, looking at this, is there anything that you see that we need to add to that?
Excuse me, got this cough.
Well, I'm not the expert, but it looks good to me.
Susan, it's Denise now. I'm also thinking that having some of the traumatic experiences maybe it doesn't go in this particular section, but the trauma and, these patients, they don't want to, and doctor, this, that, I read it on Facebook and I'm on the group with oral cancer survivors and for head and neck. And I just sit back and tears start to stream down my face because maybe we could have seen this sooner. And maybe people just don't understand that oh my gosh, what you have to go through.
Right.
And then you lose your tongue, you lose your salivary glands, and you can't swallow anymore. And all of these different side effects to having this, not to mention being the most debilitating, because it's deforming a face, and that's the face of you. That's something that takes you to work every day. You're in front of people every day, and you have to overcome, you're going to get some post-traumatic stress because you're going to have to overcome the fact that people are going to look at you and they're going to wonder what happened.
Right. Well, one thing Patty and I had discussed was having head and neck oral cancer survivors come and testify.
Yes, I agree.
At the hearing.
Yeah.
When all of this is presented.
Yep.
We certainly have some instruments, some quality of life instruments that define that, and it's linearly associated with stage. So quality of life scores versus stage, and that those patients who present or who are treated with advanced stages, it follows the reason they have reduced quality of life, which is cosmesis function, G-tube dependence, tracheotomy dependence, and things like that. So that's what the instruments seek to measure. But I think, and you can say that all you want, but if you have people come to testify about delay in diagnosis and hence treatment, that might be more poignant.
Right. Yep. Right. Because we can repeat those stories all we want, but we all know that when you see it, hear it right there in front of you, it's totally different.
Yep.
Okay. Anything else, Dr. Nemechek, that you can?
No, I don't think so. I'll put some. I'll write a couple things about patient-related rationale for screening support and provider-related rationale for screening support, and then I'll talk to our prevention and community outreach gang regarding would American Head and Neck be willing to physically support either in the position paper or to come in and be a co-author.
Well, thank you. Appreciate that very much.
Okay.
Great.
Not a problem. Thanks for letting me participate.
Oh, thank you for being willing to.
Oh, it was our pleasure having you.
Yeah.
What should happen going forward? Is your group going to try to have these meetings every week until it's submitted?
Yeah, we'll probably meet next Sunday on the 22nd.
Okay.
And then have a big group meeting of all the different subgroups on the 29th. So I'll send you a link to our meeting next Sunday. If you're able to attend, that would be great as we finish this up and to all the other meetings too.
Okay, that sounds good.
We got this, guys.
Yeah.
We're going to make a big change.
Sounds good.
Yeah. Okay.
Well, it's nice to meet you guys. Thank you for letting me participate, and we'll likely visit on Sunday.
Yeah, thank you, Dr. Nemechek, so much.
Susan, thanks as always. Appreciate it.
All right, appreciate you.
Good night, all.
Bye-bye.
Good night, doctor.
Hi, doctor.
So do we want to just fill this form out real quick with as much as we have? And
yeah.
Sure.
Yeah, let's do. Let me
fill in the blanks.
Let me see. I didn't get that text sent to.
I'm going to go get my computer so that I can see a bigger screen. So,
okay.
Susan, I'm going to be gone for just 2 seconds. I'm going to go get my computer.
Yeah, I tried to get on my laptop and wouldn't let me on, so I had to run and go get my iPad. And,
isn't that frustrating?
It is. It's like, for some reason, I can do some of these Zoom meetings on my laptop, and other ones I can't. I'm not sure which GoToMeeting or Zoom or which one's which anymore. Oh, yeah.
Let's see. I'm gonna pull up.
But that was very helpful. Oh my gosh.
Yeah,
because they could, partner up, and
yeah,
gives us more credibility.
Oh, it does, doesn't it? And Dr. Nemechek is just, I've learned so much working alongside of him, and he's just got the biggest heart. Biggest heart.
Oh, that's great. There's people like him out there that are passionate and pushing, and you too, though, both you gals are just, I'm just here more of a support group because, like I said, this is not my area of expertise, just of interest and passion. To help whatever I can, which obviously isn't that much. But.
Oh, are you kidding? Are you kidding? You've done so much.
Every little bit counts.
It takes a team. So I asked.
Yes, it does.
I asked Patty what address we use, and I got back Kathy Forbes -- remember, we have our submissions in Dropbox from last year as examples. She's gonna make.
I was trying to open those, but I couldn't find them either.
Yeah. So I can stay on for 15 more minutes tonight, and then I have another meeting I have to do. So let me pull this up. Okay, so we'll need to look up the address and everything.
Okay.
Does this request represent the official position of either a dental organization or recognized dental specialty? I guess that would be yes. Dental Codology Consortium, and hopefully the subgroup of American Head and Neck Society, right?
We hope.
We'll leave that there for now, and hopefully we can add them. Does the requester or entity identify an item where they can receive any financial benefit? No. ADA copyright assignment agreement, form signed and included with this action request.
No.
So we need to look at copyright form. I saw that somewhere. Here it is. That's the request form. Each person or entity submitting a CDD must include copyright assignment agreement. Okay, so we'll need to fill that out. Okay. So we'll say yes, because we'll get that done, right? If no expense. Where'd that go? The undersigned, blah, 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 blah. One more proposed. Okay, so we'll get that. Get back. Okay.
What do you need? A blanket? What's it?
I know. So it looks like we'll need
this one? No, this one? This one. And then Shanty, you take it there. Okay? Good girl.
Are you talking to your babies?
Yeah, she's in my office with me now and she wants to go lay down. But the cleaning ladies were here today and moved the spot where she could lay.
let's see.
She's all settled in.
So I'm not sure exactly what goes in here. So I'll need to pull up those,
The ones from last year?
yeah, and look at those. And see how they did that. So rationale on number 3 on here, Dr. Nemechek's going to write something up for that.
And I think he's on the right track, Susan, because I think if we get into the heads of these people that, okay, fine, we need to screen the people. But on the flip side, you don't screen the people. You want to go to jail? Do you want to be sued for everything that you have?
Yeah.
I think that that's going to give us a good edge.
Yeah. Yep, absolutely. Okay. So, so let's look at it. So we need to go back and do, Lucy, do you want to look those up and finish up this first part right here with A, B, C, and D? So we really just need the address.
So you have Michelle in.
Oh, I said Lucy.
Do you want Michelle to do that? Yep.
Do you want to do that, Michelle? Look those up and see what they put for the address, city, state, email, telephone, all that.
I tried to go in and find that out in the Dropbox, and I was having difficulty finding it again, or because Patty said she put it in there. And I seen them, last year I saw how these were written, and I just don't understand what this copyright agreement thing is.
I think all we have to do is fill it out and sign it.
Fill it out.
Yeah.
Okay.
That's what it looks like.
So you want me to do A, B, C, and D?
Yeah, just finish those up. We've got B done. We're just waiting to hear back from Dr. Nemechek if we can add American Head and Neck. And we should be able to add Oral Cancer Foundation. I've sent Brian emails, but I haven't heard back. So I'll send him another email because originally he said he would be on here with us.
Mm-hmm.
And then, just see what it said on there about those, how they fill those out. And
now,
then,
if I have trouble finding this on the Dropbox, can I get back to you on that?
Yeah, and
if I have trouble.
I'll see if I can find them too. But yes, let's all work together on that.
Okay, thank you.
Oh, absolutely.
When do you want this done by?
Well,
because I'm going to be away this coming weekend, so.
Okay.
Are we meeting next weekend?
We are. So should we say, what do you guys think? By our meeting next Sunday?
That we should have a lot of this basic stuff filled out. Mm-hmm. And then what we could do is we can put it up on the screen or send the email out early of all the information that's been filled out. And if anyone has any questions, comments ahead of time to review that.
Yeah.
So that they can look at it instead of getting blindsided on the day of, sometimes you're not focused. Giving them at least a day or so just to review. Yeah. And if there's something that they say, oh, guys, you did this one wrong, it could be changed even before the meeting so that when the meeting happens on Sunday, you can cruise right through and not have any glitches.
Okay. So, Michelle, you're going out of town when?
I'm leaving Friday morning. I won't be back till Tuesday.
Okay.
I won't be.
Denise, you're going out of town too, right?
I leave Wednesday morning and I come back on Monday night.
Okay. This is correct because I leave Thursday and I come back on Saturday.
Oh, we're a bunch of busy ladies.
Yeah. I know.
Well,
so if there's something that you need me to do while I'm on the plane on Wednesday, because I'm flying to Boston, so I maybe have some opportunity to do that.
Okay.
Otherwise, I know Thursday, Friday, Saturday, I have not 1 minute of time from 7 in the morning until 6 at night
Okay. So
doing a workshop.
I'll start on this part 2, this nomenclature, where we have to enter the old verbiage and put in the new.
Yep. And then the descriptor.
Yep.
Okay.
And then Dr. Nemechek's going to give us number 3, rationale.
Rationale.
And I'll mark, so this is to revise. Where's my, so we know revise. We want to revise it. Affected code. D.
Yep.
0120. And
D0150.
D01, is it 50 or?
50.
Yes. Okay, so we got that. He's going to get that. Denise, do you want to work on part 3 then? Additional information or supporting documentation, literature?
Sure.
Research? I sent you
So I can, yeah, go ahead.
I sent you a couple emails with a couple of pieces of research in there.
Not sure I saw that. Where did you send it?
I think it was last week. I can go back through and
Oh yeah, the USCS. Yeah. And a lot of my information I got from oral IDs in background and AASH. So that's where a lot of the stuff that I picked up.
okay. And then the Oral Cancer Foundation's got a lot of good stuff. And then I think, oh, that one thing from the CDC, I'll resend that on how HPV oral pharyngeal cancers now surpassed cervical cancer. They've got some statistics in that.
Oh, good. I'm trying to think. I'm not sure I'm going to have as much time as I think that I get to do this, especially if I'm going to be in that workshop for so many days.
Okay.
I'm trying to see if there's something a little bit easier. Maybe we can send this to one of the other gals who weren't able to show up. And for tonight, I'm just trying to think if there's something a little bit easier for me to dive into, or if they want to collaborate and let me know. But I think I'll be cutting, doing more than I could do. And I don't want to do that and put you guys behind.
Understand. I know, well, the 3 of us leaving town and being gone, it's going to be tight. So what I'll do is I'll send out an email and see, just ask them.
Yeah, maybe just send an email of the recap of what we did tonight and say, okay, these are the things that we need. And we need help from you guys to help us with that. So maybe you might want to do that.
I'll do that. Okay. All righty. What else, you guys? Thank you so much. Thank you. I think Dr. Nemechek's input, we've got a good jump on this.
Good basis now.
Yeah.
You know what? I like his verbiage. He's got some really good professional verbiage that is going to be extremely helpful.
Yeah. He knows that.
And he knows what needs to be said.
Yeah. And having had worked with the ADA on their oral cancer protocol that they came out with, he's got a good handle.
And he's involved with that group that actually is all about prevention.
Yeah.
Yay.
Yeah. Okay. All right.
We got a good start here.
Yeah. You guys have a great time. Have great trips.
Yeah, you too.
Thank you. You too. Hey, Susan, before we hang up, when you send that email for everyone to review, I would put in there number 8 and what we decided, that it's changing from the 0120 and the 0150, and this is the verbiage we're taking out, and this is what, we were talking about putting in. And then I would ask their opinion. So yes or no, is this good? And if not, then send us something revised so that we can take a look at it. If they have any other ideas that they feel should go into their mind. But I think we're clear cut and we're covering all tracks.
Yeah.
So, but I think that they should still have an opportunity to review it and give an opinion, because maybe they want to add or they know something that we don't know.
Right. Right. Yeah.
Perfect. And you might want to change my on case studies and stats where it says the first number one person every hour every day dies in the United States of oral, should be oro, O-R-O. Because I separated it, I probably didn't even pay attention.
I didn't even notice that.
Yeah, I did.
Okay. Okay.
Thank you.
Yeah, absolutely. Okay, anything else, Michelle?
Nope, I got my assignment.
Okay. All right. And,
Good.
I like what you said, you guys, about sending an email and asking for assistance. So thank you for that.
Yeah.
So I'll send that out, and if you guys have time to just respond and, encourage everybody to, if they can just do a little bit, that would be awesome.
Absolutely. And like I said, if I can squeak some time in, I'll try, but I know that I won't be on that call on Sunday. That's my anniversary. So my husband has some special things planned in Boston. So yeah.
We're celebrating our anniversary a week early too this week. Ours is next weekend. Our anniversary is next weekend, but we're going to celebrate it this weekend too.
Aw, see? It's all these September anniversaries.
Yeah.
Happy anniversary to both of you guys.
Thank you. Happy anniversary, Michelle.
Thank you. You too.
Okay. Well, let's call it a meeting. Thank you guys for everything. Appreciate you.
And you. So if you need something, Susan, text me and let me know if there's, something that I need to really focus on.
Okay.
Okay.
All right. Okay.
Good night, ladies.
Good night. Thank you. Bye.